And I want to thank Debbie too. We did a year or two back an initiative called 50 Ideas to Improve Healthcare, to find out how we could make healthcare better in this country. And Debbie, thank you. You made not just the doctors and the board available, but your nurses and your medical staff all throughout the hospital. So thank you for doing that. I talked earlier about Reliant Hospital, Reliant North Houston. I had the opportunity to tour this rehabilitation facility here a number of weeks ago. Very impressed by the quality of care that they're providing in our community and by the investment that they've made. I'd like to have Abe Sims, the CEO of Reliant North Houston, and just as St. Luke's was pointing out, this is not the only facility that will get stopped by this legislation. Reliant's North Houston facility isn't the only one that would be stopped in its tracks as well. So to give us a little insight on their situation, please welcome Abe Sims. Abe.
Well, we'd just like to thank Congressman Brady. I know when he toured our facility, I'm tremendously impressed by your level of knowledge of healthcare, and you're a tremendous advocate for all the physicians and providers and the patients in the community, so we thank you for that. Well, he mentioned several things about our facility. We partnered with roughly 40 physicians in our community and invested $28 million. And it takes a long time to develop a hospital, so far before the arbitrary deadlines that are being put in place now ever came about, we invested a huge number of dollars. So $28 million, we created 150 jobs for the community, $7.2 million payroll, annual property taxes of $420,000, FICA taxes of $750,000, and we've increased access to care for this community. Part of the reason why this exists and why the physicians were so eager, 40 physicians were so eager to participate, was because this is a needed service in this area, and our physicians across the board, invested and not, will tell you the same thing. So we feel like we provide a very necessary service. We serve patients that have suffered strokes, CVA, Parkinson's, spinal cord injuries, multiple fractures from trauma potentially, so patients in great need, members of this community. And because our physicians are partnered, they're incentivized to control cost. Okay, 80% of our patients go home. An average length of stay of 12 days or less. So not only do they provide high quality of service, they're also focused on controlling costs because they're investors in the hospital. So from both standpoints, it's very effective having physicians partner with our facility. So I also want to say that the arbitrary deadline is really, it's a silly thing, honestly. We took our first patient January 2nd, partially because we're delayed by a hurricane in our construction. Okay, we followed all the rules all along the way, and here we stand, being threatened to shut down because of some arbitrary deadlines that are being put in place. So we thank you for your advocacy, and we really appreciate that. I'd like to turn it over to Emmett Moore. Again, we have 7 other facilities that could be affected by this legislation all across Texas, providing the same level of care potentially. So I'm going to let Emmett Moore speak to that. He's our our president and CEO of Reliant Healthcare Partners. Emmett.
Thank you, Congressman. Thank you, Abe. Hospitals come in a lot of different varieties. There are acute care hospitals like St. Luke's here. There's specialty hospitals, more like heart hospital, more like an orthopedic background hospital. There are OB hospitals, also post-acute hospitals. And Reliant operates post-acute hospitals primarily in the rehab area where we're treating patients for usually physical deficiencies resulting from an illness. We are a needed service that most communities in the United States today are underbedded for. If you look across the United States today, there are very few hospitals that are really focused on treating a patient for those deficiencies once they're discharged or need to be discharged out of the hospital. Our company really today we're mostly Texas, but we have 7 facilities which are going to be affected by this arbitrary date that Abe and Congressman talked about. The one of them here in the Woodlands that is open, we have 6 others that are under construction right now. So we've got committed right now about $175 million in Texas for projects that aren't yet open. We also are looking at of hiring about 1,100 employees for those hospitals. They are all partnered with physicians. They are all participated by anywhere from 25 to 35 physicians in that community who really see the need for being able to provide a place for a patient to leave the hospital and go get rehabilitation care that they need really following an illness or an injury that occurs. Let me kind of give you a little bit of background. I would say in most communities in Texas, just looking and limited to Texas, but also focused a little bit on Harris County and Montgomery County here, is you've got an area where a patient who has a stroke comes in, gets treated in the acute care hospital. That particular patient can be stabilized medically, but they've got a deficiency resulting from that particular spell of illness that they're in. Today, there is insufficient number of beds in the community, and we haven't even yet, and most of our patients, by the way, are generally Medicare patients. We haven't even seen the baby boomers come along. We haven't seen the bubble that's going to happen in the older community here. We've got to find a place to put those patients. They need to get transferred out of a high-cost general acute care hospital when that hospital now has reached the point at which it's given the maximum care, given the type of care they need to be stepped down into a post-acute environment. That's what really rehabilitation hospitals do. We're fully blown hospital, fully licensed hospital, but we're treating that patient for trying to get them back into the community, get them back into functionality, and treat them where they can come back to independent living. We all have our parents and we know our loved ones. We don't want them convalescing, but the unfortunate part is if we don't provide those beds. This type of law will certainly eliminate a lot of the hospitals that today are going to be servicing the state of Texas, servicing this particular part of our state. With 7 other projects and right now under construction, we think this law is arbitrary and it's really limiting the amount of care that we can give the patients to them when they need it, and that's going to be in the very near future. Again, it does take 2 to 2.5 years to develop one of these hospitals from the very beginning to the very end. And as a result, you start committing capital to these projects, and you start committing physician involvement in these and really sitting in the design and the need for them long before an arbitrary date of getting it licensed and moving forward. So there's a lot of commitment there that's going to be injured if this particular law is passed the way it is. We need to get that eliminated from this law so we can continue to provide the care and have the beds we need, be it the acute care side of our ledger or being in the post-acute side of this. Thank you, Congressman.
Thanks,
Appreciate it.
Appreciate it, sir. Well, I'd like to hear from 2 of our St. Luke's physician partners about this project as well. Let me first introduce Dr. Vincent Aquino, St. Luke's Lakeside Hospital physician partner, and also very helpful, informative to me on our 50 Ideas initiative. Thanks, Doctor.
Thank you. Thank you. Given the scale of the order of complexity and looking at fixing healthcare in this country, it would seem that to me almost amazing to think of how much emphasis has been placed on physician ownership in hospitals. But I'd like to take this opportunity and perhaps to be very candid and from a physician's viewpoint. I would like to pose that all hospitals in this country should have physician ownership. I think when physicians have a vested interest in the hospital and come to partner with the administrative staff, CEOs across the country, and those who actually help administer health care outside of the physician base, you'll see that there is a greater collaboration, and at the end of the day, it's actually in the patient's best interest. I was preparing for this morning looking at, think about this for a moment. When hospitals and physicians sit on different sides of the street, where is the incentive to perform as a team? I mean, our goals are one and the same, are they not? And I literally went down a point-by-point basis here, but at the end of the day, we're all here to care for the ill, no matter whom the patient is or what type of insurance they carry. Provide high-quality, uncompromising care and service. And I use the word uncompromising intentionally. We look at potentially rationing services across the board in this country in the near-term future, and I hope that will not compromise the kind of care we deliver on a day-to-day basis in our hospitals. To assure that evidence-based medicine and practice guidelines are followed and that appropriateness criteria are met when requesting imaging studies or any procedure or treatment that is indeed expensive. To act efficiently in providing appropriate services while never losing sight of the need to look at length of stay and cost. Cost is important. To reward the team for providing excellent outcomes in an expedient manner while avoiding unnecessary extra days in the hospital or unnecessary testing. Pay for performance is directed at the team in this new environment where hospitals and doctors are joined. It's not directed at the doctor alone. It's not directed at the hospital alone. After all, it is the physician that controls the patient's length of stay, the doctor who writes the orders requesting numerous tests, and indeed, if you're not looking at these things and delivering on a day-to-day basis with efficiency, then you can see how cost just runs up and up and up and up. It's very difficult for a solo practitioner to try and make rounds at a hospital when they have an office full of patients in the morning and they've elected to do their rounding in the hospital lunchtime. Those patients don't get seen until the lunchtime hour. A half a day has gone by. If the patient's due to go home that day, you've tied up a bed for the morning length of stay. What if that doctor decides, oh, this patient's not ready to go home and they need some further diagnostic testing, additional tests are requested, and they may not even be scheduled to the following day. There are a lot of inefficiencies in the system, but it is the physician that indeed wields the pen and can run up the cost. Those doctors, and I have to say very clearly in our business of looking after ourselves, what is this issue of physician ownership? Why so much fuss? Well, it really boils down to an issue of overutilization. The media has helped illustrate to many, and the public has been led to believe that when physicians are allowed to have ownership, candidly, there may be overutilization, which is self-gratifying, obviously. On the other hand, as you've seen in many different industry out there this recent day and age, there are bad seeds. Does that mean that all physicians who act in the best of integrity, with their best integrity and on the patient's best behalf, are going to do the same? Absolutely not. I think that if governed properly and rewarded according to performance in providing efficient, high-quality care and outcomes, physician-owned hospitals could prove to actually be the model for efficiency and avoiding waste and unnecessary testing, using appropriateness guidelines, and you've heard me say that before. I thank Kevin for taking the interest in supporting our efforts. I think at the end of the day, specialty hospitals, physician-owned hospitals will actually prove to provide cost savings with ease and facilitation of care. This community will find that it's much easier to have access to higher levels of care that we've found only in the medical center in years gone by, as we try to emulate and recreate some of those models right here. Thank you.
Great. Thanks, Dr.